If you're new here, my name is Imani Fitch. I am a labor nurse turned birth coach, doula, childbirth educator, and now I'm a first-time mom. So I'm really excited about today's episode. It is about how to have a natural birth. I recently shared my birth story for the world to see, something very intimate, very vulnerable, but ultimately the reason why I was empowered and excited to have a natural birth was because I had seen it before. I actually have been watching birth videos probably for like 6 years. If it wasn't for people sharing their stories, I highly doubt that I would be in the place that I am, advocate for natural birth, and able to not only teach people how to achieve that goal, but also being able to achieve it for myself, which, by the way, I was not sure I was going to be able to do it. Yeah, I seriously had doubts, and I think that's normal and natural, especially when your body is going through so much. But God was with me, and He said, "We having this baby, no meds." And I said, "All right, let's do it." It's funny, I was actually talking with a friend who is expecting, and she desires to have a natural birth, and was kind of trying to figure out, okay, where do I go from here? I have this desire to at least attempt to have my baby without any epidural medication. Now that I have that desire, what do I do now? And I think that that is where a lot of people land when they think about having a natural labor, a natural birth, and they go into their appointments and they expect their provider to not only encourage them, but to tell them how to do it. And unfortunately, that's just not how our system works. And so I knew that it was important for me to talk through my experience and the experience I've had with helping people have their natural births exactly how they desired and planned for it to go. And so first, I want to kind of define what I mean by natural birth. There are so many people in this birthing community that have their definitions and decide what is right or who counts as having a natural birth and who doesn't. I'm not the police right here at all. I am just calling a natural birth, giving birth without an epidural. That's it. A vaginal birth without an epidural. So if you have any other definition of a natural birth, that's fine. But we're working with my definition right now. So if you align with that definition, definitely lean in so we can talk through how to achieve this outcome. So first, I would highly, highly recommend, if you desire to have a natural birth, to think about why. You're going to have a lot of people that are going to come against you because birth experiences bring about a lot of internal fear, trauma that people have experienced or have seen. I've said it in episodes before that you don't have to go far to get a negative picture of birth. It's kind of like inundated with us. We all have seen movies, TV shows depicting birth as this very scary, painful, traumatic, even life-threatening thing. And so subconsciously, most people are going to push back against the thing that could cause you pain or harm, which is a lot of times it's out of love, but it just doesn't come across as such. So if you are even going to tell anybody what you want to do, which I will say I did not share with most people because I'm a labor nurse. I didn't share with coworkers or people who are in my industry that wouldn't understand that I wanted to have a birth center, which means out of hospital, natural water birth. I did not find it necessary to share with people who could potentially fight me or make me doubt and have negative statements or even just a facial expression. I didn't have time for that. I needed to protect me and my birthing space. So I was very selective about who I chose to tell about my plans. And then on top of that, I knew my why, because not only in pregnancy are you going to have opposition, but obviously in the birthing process, in labor, you're going to have opposition internally as to why am I doing this? You first need to take the time and decide within yourself your why. If you feel like it's something that is a potential or option, that's fine, but it makes the probability of achieving your goal a lot less likely. And that's simply because, like I said, there is going to be opposition externally and internally to the goal that you are trying to achieve. And so after you decide your why, you determine your why. Again, if you do not want to have a natural birth, that is fine. That's okay. My goal for women is to reduce the risk of trauma. So that means supporting you in your desires and what makes you feel safe, what makes you feel cared for, loved in your experience of birth. So now you've decided why you want your natural birth experience. Next thing to do is to continue doing research on how to achieve that practically and making a plan. You want to research what are the things that make the likelihood of achieving a natural birth most possible. And some examples of those things are going to be your provider. If you are not pregnant right now, and in your mind you think you want to have a natural birth, you need to be researching a provider and a facility that encourages natural birth. You need to talk to people who have done it. You need to get their experience and get their recommendations, because that is going to be the number one predictor on your success. Is the person who is your main care provider not only tolerant of your desire, but are they going to be encouraging your desire? And then on top of that, are you even in a facility that would promote and encourage? Like I'm saying, you want the most encouraging atmosphere for a natural birth. Your environment matters. Of course, a birth center at home is probably ideal for most people. Even if you're in a hospital, you can still make it a beautiful and serene and peaceful atmosphere as you're in labor. That doesn't have to take away from your goal of achieving a natural birth. I want to be so crystal clear that where you choose to have your baby in hopes of a natural birth is the number one predictor on whether that will be successful. And so as you continue to do your research, create a plan about your approach to preparing for birth. And as you create this plan, you need to be communicating this plan to the people that are around you. That is going to be your birth team. I've talked about it in episodes past, but that's going to mostly include your care provider, like your OB or your midwife, your spouse or your partner, and your doula. If you want to have a successful natural birth, if you want to have an enjoyable natural birth, these are the people that I would, at minimum, recommend to be with you, caring for you. Can you achieve a natural birth without some of these people? Absolutely, yes. But my opinion is that the enjoyment of the experience is definitely magnified when you have at least these three players on your team. And so in line with what I've already kind of stated, you are doing your research, you are creating a plan, and you are putting that plan into play by choosing the people who will be there to support you and communicating your plan with them. Now, I will also add this caveat. I'm not talking about a birth plan. I'm just talking about your approach to preparing for your natural birth. If you don't hear anything else in this video, I want you to hear this. I tell this to my clients all the time. I tell it to my patients all the time. I tell it to random strangers all the time. When you go into labor, and it doesn't matter whether it's natural or if you have an epidural, labor is about 80% mental and 20% physical. I'm not kidding you. If you talk to anyone who has actually had a successful natural birth and you ask them how did they do it, I guarantee that they will not say, oh, I worked out a lot and that's how I was able to do it. Or, oh, I just have a really strong pain tolerance. That's how I was able to do it. I would really like to meet a person who would say that is what got them through the throes of natural labor. In my experience, the thing that gets people through natural labor is their mental fortitude. And by that, I mean their ability to stay in the moment, their ability to relax, using their mind to relax and to cope and to get through really uncomfortable sensations. And I do believe that almost anyone can do it, but it absolutely requires practice. You may have heard it said like this: you would never run a marathon without training. Shoot, most people would never run a 5K without doing a couple runs beforehand. I think the best analogy is going to be a sports analogy, because labor is physical. It's just in a different manner. But no athlete is going into the big game without preparing. They do prepare physically, but they absolutely are preparing mentally. They're hyping themselves up. They're learning about their opponents, or they're training their mind to endure going past their physical breaking point. And that's what you need to be doing if you were ever even thinking about having a natural labor. And honestly, even if you're desiring an epidural, it's really important to train in this capacity, because you never know what could happen if you get into labor and maybe you've progressed so fast that you're not able to get an epidural, or you could get an epidural and it stop working. I'm sure you've heard that before, but I've seen it happen so many times, and you just never know until you get in the situation what that anesthesiologist is going to be like, or what your body shape is going to be like. Preparing for the mental fortitude in order to reach your goal and have it to be an enjoyable experience is going to be absolutely the number one way to prepare for natural birth. So let me tell y'all a few of the ways that you can prepare mentally. That's going to include practicing your breathing, getting in touch with yourself personally and emotionally, and how you need help when you're coping, or the internal fears that you have, and addressing them and having affirmations that speak to your fears. That also looks like training yourself to be able to relax your body, relaxing every single muscle, even like your facial muscles, your thigh muscles, your butt muscles. Most people don't realize that when they're stressed, when they're feeling pain, they clench their butt. And so you even need to train your body to release that muscle in the midst of discomfort. And so you can go on YouTube and get videos about all these things. There's a bunch of like really good, really high quality videos about labor breathing, about affirmations, about fear clearing, about relaxing your body. YouTube's a great resource for all that, but I would highly recommend hiring somebody to walk you through that. These are things that your doula can help you with. And that's because it takes a lot of work. It takes a lot of hours to comb through YouTube to find the videos that are actually going to be helpful. If you are working with a professional who can ask you questions, can walk you through what actually will be most helpful for you and make it a customized, personalized experience, I'm sure you can see how that would definitely improve your experience and your preparation. And not only that, but make it more efficient. Like, you don't need to waste time. You really don't have time to be wasting looking for all these free resources. I get it when you're on a budget, but what's most important when you're preparing for this life-changing event? You. And so you're worth it. Invest in you, because you're the one that's going to be the most affected by this experience. And so it's of the utmost importance to ensure that you are cared for as well as possible. Don't skimp on yourself, especially not in this area. Now, we definitely need to prepare physically. Just because mental preparation is of the most importance doesn't mean that physical preparation doesn't matter at all. Now, I can tell you, as a labor nurse, I've seen many types of bodies have a natural birth. And so I don't want you to think it's about being fit. While that is great for your health, that's great for your well-being, if you are not, don't count yourself out. You can absolutely still have a beautiful natural birth. For me in my pregnancy, I was not really able to work out. I did as much as I could, but I really depended on these at-home YouTube videos to just help, maybe 15 or 30 minutes to get my body moving, circulation going. But it's less about your physical strength and a lot more about your muscles and your ligaments being loose and limber. And so stretching is going to be really good. Think about movements as far as fluidity and less about strength. You actually might be working against yourself in the goal of natural birth when you're focused on strength, because as you're strengthening your muscles, especially as women, we're often doing squats and going really hard on leg day and stuff. Your pelvic muscles don't necessarily need to be strong. They need to be able to move out of the way so that the baby can come down and descend through your pelvis. So I would encourage you, if you are a heavy lifter, to think about ways to incorporate movement that lengthens your pelvic floor muscles and lengthens your body. Think Pilates, think stretching, think swimming, think dancing. Like, you want these movements that are more fluid and less static and heavy in weights. Another way you can physically prepare is by practicing your coping skills. So that, again, looks like learning from your doula or another resource, things like hip squeezes, counter pressure. You'll need someone to help you with this, but hip squeezes, counter pressure, the Miles circuit. These are positions that you would get into not only to optimize the experience of the contractions or the waves, whatever you call it, but these are also going to help your baby get into the most optimal position. And speaking of the baby, I think it's not common sense for people to consider the baby when it comes to birth. When your baby is in the proper position, that is head down, that is face down, and able to descend, that is what helps labor to progress. If you've never taken a childbirth class or you don't know much about it, check me out. I do teach birth classes, but there are a million resources for that as well, about the stages of labor. And in labor specifically, it starts with contractions, obviously. But unlike the movies, it doesn't start really painful and then the water breaks and then the baby's out and you're screaming. It's a little bit of a dance. The uterus and the baby are working together to descend and eject this baby through your body. And so baby goes through a series of movements in order to come out, and you want to flow with your baby. Think of it like that. You want to flow with your baby so that your baby can work with you and not against you to progress your labor, ideally as fast as possible. I know for me, I was in labor for 3 days and my baby was in a good position. So there is a little bit more to that, but ideally, the baby does play a huge role in labor progression, in which you do want it to be relatively short. And so as you're preparing for your natural birth, and I'm praying you get to experience that and it's an enjoyable, beautiful experience, remember that these are just principles. As you do your research, customize your plan for yourself and approach your preparation and your training for your natural birth. It takes investment, but there's no set time as far as how long it will take to prepare. If you're pregnant, start now. Think about what you desire and go for it. Natural birth can be peaceful. I'm not saying it's easy. I'm not saying that it's painless, but I do believe that it can be enjoyable and beautiful and peaceful. And I'm confident that you can experience this in a way that aligns with your desires and your values. So if you found this helpful, go ahead and share it with someone else that would enjoy and benefit from this information as well. If you would like to take the next step and figure out what is your plan, what is your approach, go to my website. I have a few spots available on my calendar where we can talk about how to set up a plan for you to achieve your goal of a natural birth. We can talk through a preparation checklist and your desires and the approach that will be best for you. Now, if you're not sure if you want a natural birth, I get it, completely understand that. I feel like this was just the tip of the iceberg. So if you have further questions, go ahead and reach out to me on social media at Confident Care Birth Co. I really love to hear from you and answer any questions, but that's all for right now. Make sure you subscribe. It really helps me a lot, especially knowing that you are enjoying this content. But for now, I'll see you on the next video.